In a bold move that has sparked both relief and controversy, West Coast states are taking a stand against the politicization of public health, particularly in the wake of the Trump administration's actions. But here's where it gets controversial. As federal guidance becomes increasingly unreliable, California, Oregon, Washington, and Hawaii are forging their own path to protect their communities. This comes after Secretary Robert F. Kennedy Jr.'s recent overhaul of the CDC's Vaccine Advisory Committee, which many see as a direct assault on science-based decision-making. So, what does this mean for you? Let's dive in. Vaccines remain one of the safest and most effective tools we have to combat respiratory viruses like COVID-19, influenza, and RSV. Seasonal vaccinations aren't just about individual protection. They're a critical public health measure that reduces severe illness, slows community transmission, and eases the burden on hospitals. Yet with trust in federal institutions waning, state leaders are stepping up to fill the void. Dr. Erica Pan, director of the California Department of Public Health, reassures residents, "We are committed to using data and evidence to help you make healthy choices. Our goal is to protect our communities, no matter what happens at the federal level." California has even passed a new law to ensure its vaccine recommendations remain independent of future federal guidance. And this is the part most people miss. This isn't just about vaccines. It's about restoring trust in public health institutions at a time when it's needed most. Dr. Sejal Hathi, director of the Oregon Health Authority, adds a personal touch. "As a physician and a new mother, I know how vital vaccines are for preventing illness and saving lives." Oregon is choosing to prioritize public health over politics, ensuring every family can access protection this respiratory virus season, simply, safely, and affordably. Her words highlight the human impact of these decisions, especially for vulnerable populations like newborns. Washington State Secretary of Health Dennis Worsham emphasizes the communal benefits. Vaccines protect not just us, but our families, neighbors, and entire communities. By staying up to date, we can keep our state strong and reduce the spread of illness. Meanwhile, Kenneth S. Fink, director of the Hawaiʻi Department of Health, underscores the importance of trust. Public health institutions must earn the public's confidence by acting with humility and relying on science. That's exactly what we're doing with these recommendations. But here's the controversial part. Secretary Kennedy's actions at the CDC, firing all 17 members of the Vaccine Advisory Committee and replacing them with appointees who include vaccine skeptics, have raised alarms. Public health leaders argue this politicizes decisions that should be based solely on science. Expedited meetings and high-level resignations further suggest a dismantling of independent oversight, leaving many to wonder, can we still trust the CDC? What do you think? Is this a necessary shakeup or a dangerous politicization of public health? In response, the West Coast Health and Climate Alliance, WCHA, is taking matters into their own hands. Health officers and medical experts from these states have reviewed guidelines from trusted organizations like the American Academy of Pediatrics, AAP, and the American College of Obstetricians and Gynecologists, ACOG, to develop their own recommendations. Their goal? Ensure that health advice is rooted in safety, efficacy, transparency, and accessibility. The WCHA is committed to ongoing evaluation, transparency, and community engagement. They'll continue to update their recommendations as new evidence emerges, ensuring residents have access to the best available protection. But here's the question. As federal and state guidance diverges, who will you trust? And what does this mean for the future of public health in America? To learn more about these updated recommendations, click here. Link mclist.us7.listmanage.com /click AFFA5AD455B equals CFI 694251. Let's keep the conversation going. Share your thoughts in the comments below.